Hi, this is Kelsey from Inspired Elite Solutions. Today we'll be working on the Mindfulness Tool Kit. Get out a pen and a paper. You might want to take notes. This is a really large document, so I suggest saving it in an appropriate place where you can access it. And you might want to refer to certain pages and print out just a couple. So as we go through this document, I want you to keep in mind situations in life that you want to work through without any destructive or old behaviors. Something that's stressful, maybe conflict, or just stuff in life. So this will help us through that. On page 4 of the document, it has an overview of the 4 different types of skills that we'll talk about. The first one is core mindfulness skills, then interpersonal effectiveness skills. The third is emotional regulation skills, and the fourth, distress tolerance skills. So for core mindfulness skills, this starts on page 11 of the document. In this module, patients learn the consequences of behavior patterns by using awareness skills. The ability to apply verbal labels to behavioral and environment events is essential for both communication and self-control. Such awareness skills will enable patients to handle any given situation with a clear and rational mind by stepping back, analyzing the event, and implementing an appropriate response. The second one, interpersonal effectiveness skills, that starts on page 33 of the document. More often than not, our emotional state dictates how we handle a situation. Some of us vacillate between avoidance of conflict and intense confrontation. Our main objective in this module is to teach patients how to apply specific interpersonal problem-solving, social, and assertiveness skills to modify adverse environments and attain client goals in interpersonal encounters. Now, the third one, emotional regulation skills, that starts on page 68 of the document. It is not uncommon for patients to self-regulate their emotions by denying their true feelings. For example, do you smile when you feel unhappy in order to hide some inner pain? The first step in emotion regulation is identifying one's emotional responses and describing the context in which emotion occurs. In this module, patients learn to understand the nature of emotions, identity, and label emotions in everyday life, reduce vulnerability to negative emotions, and increase positive emotional events. And the fourth, distress tolerance skills. That starts on page 117. Pain and distress cannot be entirely avoided or removed from daily life. The inability to accept this often leads to increased pain and suffering. In this module, we teach patients to bear pain and distress skillfully by becoming less judgmental. Essentially, distress tolerance is the ability to perceive one's environment without putting demands on it to be different, to experience your environment without putting to observe your own thoughts and action patterns without attempting to stop or control them. A client learns how to tolerate and survive crises, all while accepting life as it is in the moment. Okay, so let's talk a little bit about goals. If you turn to page 5 in the document, this is a good page to print out. So, goals of skill training. The general goal is to learn how to change your own behaviors, emotions, and thoughts that are linked to the problem in living and causing misery and distress. The specific goals: behaviors to decrease, mindlessness, emptiness, being out of touch with self and others, judgmentalness, interpersonal conflict and stress, loneliness, absence of flexibility, difficulties with change, ups and downs and extreme emotions, mood-dependent behavior, difficulties in regulating emotions, impulsive behaviors, acting without thinking, difficulties accepting reality as it is, willfulness, addiction, skills to increase, mindfulness skills, interpersonal effectiveness skills, emotion regulation skills, and distress tolerance skills. So those are all of the different skills that we just talked about. So now this has a place where you can fill out some goals of behaviors you want to decrease and skills to increase. Pause this video while you do that. Now let's look at a couple examples that I think are really helpful. If you go to page 24 in the document, there's mindfulness handout 5A. This is ideas for practicing non-judgmentalness. Leaving out comparisons, judgments, and assumptions. So number 1, practicing observing judgmental thoughts and statements, saying in your mind, a judgmental thought arose in my mind. Number 2, count judgmental thoughts and statements. Number 3, replace judgmental thoughts and statements with non-judgmental thoughts and statements. Tips for replacing judgment by stating the facts. Describe the facts of the event or situation, only what's observed by your senses. Describe the consequences of the event. Keep to the facts. Describe your own feelings in response to the facts. Remember, emotions are not judgments. And number 4, observe your judgmental facial expressions, postures, and voice tones. Change judgmental expressions, postures, and voice tones. Tell someone what you did today non-judgmentally or about an event that occurred. Stay very concrete, only relate to what you observed directly. And it goes on to talk about writing out a non-judgmental description. So we're not judging ourselves. Now I want to talk about an example of an interpersonal effectiveness handout. This is on page 45 of the document. Guidelines for self-respect effectiveness. Keeping respect for yourself. And there's an acronym using FAST. So be fair, no apologies, stick to values, and truthful. So this is talking about being fair to yourself and other people. Don't over apologize. Stick to your own values. And don't lie. Now moving on, let's talk about an emotional regulation worksheet. It's on page 95 of the document. This one is opposite action to change emotions. So you're going to talk about an emotion that you have, rate it with intensity before and after you do this. The prompting event for my emotion, the who, what, when, where. Is it my emotion, or is it intensity or duration? Justified? Is it fit the facts? Is it effective? Now this goes on to talks about if you're justified or not justified, and the urges and opposite actions that we might want to take. Moving on, a distress tolerance worksheet. It's on page 126 of the document. This is effective rethinking and paired relaxation. This step 1, describe one typical promoting event for distress in your life, what led up to it, what it is, what this event is that is problem for you. Be specific, use describing skills. Now step 2, ask, what must I be telling myself? What are my interpretations and thoughts? Write this down. Step 3, rethink the thoughts that lead to distress. Rethinking involves reevaluation of the situation, and it's meeting in ways to counteract the stress-producing thoughts, and this will reduce stress. Step 4, did you practice in your imagination effective rethinking of a stressful situation this week? And step 5, did you practice rethinking plus paired relaxation? So that comes to the end of the examples from the document that I wanted to share with you. So what I want you guys to do now is to choose things that you think will be helpful to you to keep in your toolkit, and keep in mind this is something that is private for you that you can use in your life. So be thoughtful in what will actually help you overcome a trigger or some kind of stressful situation. Thank you.